So our diagnostic findings, which also includes on this slide our differential diagnosis, is beginning with his prostate exam. He did have a boggy prostate. This was warm to the touch, tender and swollen. This was not to be expected. This is an abnormal finding. Also, we did urine cultures. Urine cultures did show positive for bacteria. We would not expect to have bacteria in the urine unless there's some type of infectious organism. Pelvic x-ray was done, which showed prostate calculi. So there was some kind of like stones in development in the prostate, which we would not expect to find either. CBC, chemistry, and PSA. His did have an elevated PSA, which is normal, can be not normal, but can be expected with prostatitis. And he did have elevated white blood cells from his blood culture or his CBC. So some of the things we need to rule out as far as differential diagnosis is your UTI, kind of a standard urinary tract infection with urinary tract stones. We're trying to rule out acute cystitis, benign prostate hyperplasia. We're looking at, or hypertrophy, pelvic pain syndrome is something we need to rule out. Bladder cancer. We would not, with the findings of a non-tender, non-palpable bladder, we should, that was something that could be ruled out a little bit, and as well as the pelvic x-ray, not having any positive findings in the bladder. Prostatic abscess, we've ruled out with exam and with the x-ray as well, and the ultrasound. So the diagnosis that was given based on findings and clinical signs and symptoms is chronic bacterial prostatitis.